Good morning, good afternoon, good evening, everybody. Welcome to the Global Digital Health Network monthly meeting. We're just going to give everyone just another minute to join. But while you're waiting, I also want to make it known that we have interpretation for this session. So please do join the channel in which you would like to listen to this webinar.
Christine, I just want to make sure you saw my message. If you can turn off the other me as a co-host and then give me permission to record, that should work.
Okay. All right, we're going to get started so that we can keep us on schedule. Good morning, good afternoon, good evening. Welcome to the Global Digital Health Network monthly meeting. We're really excited that you all have joined us today, and I'm really excited about our presentations today as this meeting is being jointly hosted by Youth Tech Health, or YTH. So just a few housekeeping announcements. We are offering interpretation for this meeting. So please do choose the channel in which you would like to listen in. We have options for English and Spanish. You can remain in the main channel if you would like, and you will hear a mix of both English and Spanish. And if you are having trouble with the audio, you can always mute the original audio, and this will ensure that you can hear the language that you choose. Please also direct any questions to the presenters into the Q&A box so that they can answer your questions at the end of the session. My name is Christina Villela. I'm one of the co-chairs of the Global Digital Health Network. We organize these monthly meetings to highlight work happening in the digital health space each month. And we also host the annual Global Digital Health Forum. And so some of you may have received our call for abstracts that opened earlier this week. So please do take note that the call for abstracts opened, and those are due September 17th if you would like to present at the forum. And we also soon to send out a save the date. So consider yourselves the first ones to receive the save the date. We have scheduled the forum for December 6th through 8th of 2021, and the forum will be a virtual event. So we're really excited for the event. We're busy planning, busy getting the virtual platform set up. But right now, we hope you all just focus on submitting your abstracts and ideas to us to put together another awesome schedule of events. And that you can see there is the website where you can get more information about the forum and as well as the link to submit abstracts. So here's a rundown of today's agenda. So I'm going to actually turn it over to Rebecca, who will run us through today's agenda. But I did want to introduce Rebecca Braun, who is with ETR and is the program director for YTH. And they have put together this lovely panel of presenters who are going to talk more about the co-creation of digital health solutions with youth and some of the activities and solutions that they've come up with, as well as the processes that they've used. So with that, I'm going to turn it over to Rebecca, who will introduce our panelists for today.
Great. Well, good morning, everyone. As Christina said, my name is Dr. Rebecca Braun, and I lead the YTH initiative at ETR. At YTH, we focus on using technology and new media to support young people's health and wellness around the globe, which includes developing digital programs, products, and services, providing training and capacity building, using our trauma-informed, youth-centered health design framework, and of course, our annual convening, which is the YTH Live Global Conference, and it's coming up on October 4th.
Rebecca, I'm not hearing you, so I want to make sure you're in the right channel.
Can you hear me now, Christina?
Yes.
I think I was trying to interlope between English and Spanish, but I'll stick with English. It's my native language. Well, good morning again, everyone. My name is Dr. Rebecca Braun, and I lead the YTH initiative at ETR. At YTH, we focus on using technology and new media to support young people's health and wellness across the globe. That includes developing digital programs, products, and services, providing training and capacity building using our trauma-informed, youth-centered health design framework, and of course, our annual convening, YTH Live Global, that is coming up on October 4th through 6th, and you'll hear a little more about that later. I'm really thrilled to moderate this panel of experts who will illuminate the challenges and learnings from co-designing innovative digital health solutions with and for youth during a global pandemic, in a region where discussions of sexual health, abortion, and intimate partner violence are often taboo and challenging to navigate. They'll each present for about 10 minutes, and then we'll have 15 minutes for a live Q&A. So get your questions ready, or if you've got a burning question, put it in the Q&A, and we'll hope you get a chance to get to it. We'll also make sure that you can contact all panelists after today's conversation. So to start, I'd like to introduce Emma Schlam from ETR and Flor Uceda from Go Joven Honduras, who are going to present Ellie, the first and only artificial intelligence-enabled chatbot co-designed by youth to navigate and prevent teen dating violence in Honduras. So take it away, you two. Thanks.
Good morning. Thank you so much, Rebecca. My name is Emma. I am a program coordinator at the YTH initiative. Y Flo, ¿quieres presentarte rápidamente? No, I can continue. It's okay. Flor can introduce herself when she talks a little bit. Now she's going to tell us a little bit about the situation of teen dating violence in Honduras to set the stage a little bit for us.
Hola, buenas tardes, ¿me escuchan? Mucho gusto, mi nombre es Flor Uceda, soy parte de la asociación Go Joven Honduras y soy una joven activista de 23 años por los derechos humanos con énfasis en los derechos sexuales y derechos reproductivos. Como ya lo mencionaba Emma, el contexto de violencia en Honduras pues es tan simple como que Honduras vive una regresión de derechos humanos constante. Atravesamos una crisis social y sanitaria a partir de la pandemia por el COVID-19 y el impacto de los huracanes ETA y OTA que dejó a una Honduras completamente devastada. A esto pues le sumamos los estragos ya ocasionados por los altos niveles de corrupción que atraviesa el país. Y esto de una forma u otra ha afectado de manera directa e indiscriminada a las y los jóvenes hondureños, con una alta tasa de abandono escolar y migración que se ha aumentado casi en un 100%, además de una creciente ola de violencia sexual, donde son más de 2.883 niñas, adolescentes y jóvenes las que han perdido la vida de forma violenta. La pandemia del COVID-19 ha venido a reafirmar estas desigualdades, además del marcado impacto socioeconómico que afecta a la población, y quienes son los más golpeados en este momento pues son los jóvenes. Esto lo vemos reflejado en que Honduras actualmente es la segunda tasa de embarazos en adolescentes más alta de América Latina, además de que no existe una educación sexual integral para que los jóvenes permitan impulsar su desarrollo integral. como respuesta a todo esto, Zona Segura vino a ser una respuesta muy bien recibida en un país donde 4 de cada 5 jóvenes sufren de violencia en los noviazgos durante su adolescencia y donde los jóvenes tienen nulo acceso a información sobre la violencia de género, la igualdad, las relaciones saludables, los derechos humanos y donde ni siquiera tienen acceso a la vinculación a recursos o servicios de asistencia gratuita.
Thank you so much for setting the stage for us, Flor. So Flor is from Gojoven, Honduras, and they are our in-country partners for this project. So Flor gave us a little bit of background about the situation of teen dating violence. So while those statistics do exist, we also know that 90% of Honduran youth have access to at least one smartphone. So this caused us to ask the question, how might we use technology to provide, this is a question we asked young people directly, how might we use technology to provide youth your age with educational content about healthy relationships and teen dating violence? And at the Y-Teach initiative, we use a methodology called trauma-informed youth-centered health design, and I'll get a little bit more into that on the next slide, but these generally lay out the steps, and we really spoke to experts in the field, educators, people who work with youth, providers, and many, over 43 young people themselves, to co-design the solution, to prototype with them, and then to do some usability testing. And Flor will talk a little bit more later about the process of usability testing. So this is our trauma-informed youth-centered design process, really centering youth in the process and including trauma-informed principles to make sure that in the design process, we are not triggering or re-traumatizing anyone when we are talking about subjects that are as sensitive as dating violence. And I will, in the chat, put a link into this so you can read on about it. So this is the trajectory of the project we did. We had this idea working with young people, then we did the design research, then we worked with technologists to actually build the tool. We did a 3-month study to see if this was something that young people were interested in. So we actually started this as a WhatsApp messaging campaign, and based on feedback from young people, we identified a real need for real-time responses to the questions they were asking. So you'll see throughout the, part of the human-centered design process is that it's very iterative in nature. And I think this project is an excellent example of us iterating based on the feedback that we received from young people. So these are some of the really early prototypes we started with, just drawings of what your rights are in a relationship. And then we worked with a young Honduran illustrator who brought these to life in beautiful comic-like fashion that were appealing to young people that we included in the app. These are some photos from the design workshops where we worked with young people to develop the content. And so you'll see on the bottom right, there's a sticky note. One of the activities was, what kind of messages would your friends want to receive about healthy relationships? And on the bottom right, you'll see a text, some text that says, treat others how you'd want to be treated. And that was what a young 14-year-old boy wrote that they would want to receive. And so this is what the app looked like in the beginning. We had a lot of information about a digital safety plan and some resources that young people could access. And now Flor is going to talk a little bit about what it looked like to actually recruit and enroll young people into this study to see if Zona Segura was something that young people wanted.
Flor, I think you're on mute.
Hola, sí, ¿me escuchan?
Yes.
Yes.
Hola. Ok. Listo. El proceso de reclutamiento e inscripción fue sumamente alentador al plantear Zona Segura como una respuesta para la reducción de violencia en los noviazgos adolescentes en Honduras. A través de una innovadora intervención de telefonía móvil, tuvimos una aceptación inmediata, pues en estos lugares de intervención no contaban con programas que vincularan a los jóvenes con información saludable sobre la igualdad de género o sobre las relaciones y las masculinidades saludables. Estos lugares de reclutamiento fueron colegios de educación media del sistema público, que formaban parte de estas altas estadísticas de vulnerabilidad, violencia y embarazos en adolescentes, además de ser lugares con altos niveles de inseguridad y violencia, ¿no? Este proceso de inscripción tuvo dos momentos, como ya lo mencionaba en su momento, ¿no? El primero a través de una aplicación de zona segura, donde los jóvenes podrían encontrar información primaria sobre prevención y salud. Sobre esto incluía pues información sobre derechos legales, relaciones saludables y no saludables y cómo identificar estas situaciones de abuso, ¿no? Su segundo momento fue a través de una campaña de mensajes vía WhatsApp, donde los jóvenes, especialmente los varones, recibían información sobre nuevas masculinidades. Esta información era de forma directa y era de forma accesible para que estos jóvenes pudieran tener acceso a la misma.
And can you talk a little bit more about some of the feedback you heard from young people about their experience using the app and the messages?
Claro, sí, durante su implementación, Zona Segura recibió un alto nivel de aprobación por directores de centros educativos, por padres de familia y sobre todo por los jóvenes. El 80% de los jóvenes que participaron en Zona Segura de entre 14 y 19 años reconocieron que hay diferentes expresiones de violencia durante el noviazgo que antes de Zona Segura no sabían identificar. Además que mencionaban que esta violencia estaba ampliamente normalizada en la cultura hondureña y que se presenta en diversos espacios, incluso en formas tan difíciles que eran muy difíciles de identificar antes de Zona Segura. Un comentario constante que recibimos fue que como jóvenes, mujeres que viven en la pobreza, se sienten marginadas y que a diario enfrentan distintas formas de abuso, y que antes de la implementación de Zona Segura no sabían reconocer estas formas de abuso, que estaban acostumbradas a vivir en la marginalidad, en la pobreza, donde no llega la información. Y gracias a Zona Segura les pudimos dar el acceso a esta información. Otro comentario constante que se vio reflejado en el alto nivel de la interacción con la aplicación por parte de las jóvenes fue que Zona Segura les permitió afrontar esas barreras de acceso a la información y que este factor tecnológico de Zona Segura le permitió a los jóvenes tener acceso a esta información, una información que el Estado le niega, una información que no pueden acceder en sus centros educativos, pero que Zona Segura se los pudo ofrecer.
Thank you so much, Flor. And in the interest of time, I'm going to move a little quickly. Challenges, there are a lot of challenges, tech glitches. Whenever you're building something, COVID gravely impacted the ability for in-person recruitment. And so these are some early prototypes of the chatbot. These are some of the timelines we had. So it was really important to do, we worked with partners at WebSmith to build a chatbot. And so this is what our timeline looked like, prototyping, testing, launch, collecting analytics. We did some really, Flora facilitated some amazing workshops with young people to identify who would be the person that would be accessing a teen dating violence chatbot. Who are they? What do they want? Why are they here? So we did some workshops in real time with young people to identify who is the person that would be using this bot. And this is way more technical than I can explain, but I think pretty fascinating to look at how a bot works and how it kind of logically responds to the questions that it receives. I don't know how it works behind the scenes, but it's pretty amazing and it works. This is some of the UX architecture and metrics of how the bot responds to some of the questions that it receives. Again, these are the tools we use. So working with Twilio and as well as WhatsApp. And then this is our final product. This is our landing page. And I will put the link into the chat. And this is Zona Segura. And actually, when you go on it, you will click on this cute little button and it will take you directly to WhatsApp. And this is available in English and in Spanish, which is fantastic because we are absolutely looking to expand to other countries with other communities in other languages. Something special about Zona Segura is that we do connect young people to real-time in-person services, if that is what they're looking for. So in order to make this accessible to more people, we are definitely looking to build partnerships in other countries to build out this resource database. So I will share that with you all. And then Flor is going to, based on the feedback we've received about the chatbot, Flor is going to tell us some of the great things people have said about it so far.
Sí, en definitiva, Zona Segura y el chatbot de Zona Segura ha ayudado a cientos de jóvenes a romper esa barrera de información a la que los jóvenes hondureños nos afrontamos a diario. Ha sido increíble la forma en la que los jóvenes, entre ellos mismos, han decidido movilizar la aplicación, han decidido movilizar el chatbot para que sean más jóvenes los que puedan acceder a la información que provee Zona Segura. Específicamente porque los lugares donde decidimos intervenir Zona Segura son lugares sumamente violentos, donde probablemente todos los días haya una masacre, donde probablemente las niñas estén muy expuestas a la violencia, no solo en los noviazgos adolescentes. Y en definitiva, Zona Segura fue esa respuesta que los jóvenes hondureños necesitaban para hacerle frente al contexto tan violento a la que nos afrontamos los jóvenes hondureños el día de hoy. Y son muchas las impresiones que se han recibido, vuelvo y les repito, no solo por jóvenes, por padres de familia, por directores de centros educativos, del sistema de educación, quienes han estado muy contentos de saber cómo los jóvenes de estos centros de educación pública cada día se informan más sobre cómo obtener relaciones saludables, sobre cómo manejar las distintas formas de abuso. Y el saber que los jóvenes hondureños en este momento se están cuestionando si realmente están sufriendo violencia, creo que es uno de los logros más importantes que Zona Segura puede tener y que al final de cuentas ha sido las impresiones que estos mismos jóvenes nos han hecho llegar a nosotros.
Thank you so much, Flor. And I wish we had time to read through some of these quotes, but I do want to close us out. And these are quotes from directors of educational institutes and young people who were saying, no one ever spoke to me about what a healthy relationship looks like. And then in this quote, we're talking about, especially during the pandemic, when they're closed off from the world, having this lifeline of information is so crucial, and we are so excited to get more young people to use it. I put the link in the chat so that you all can explore it. I'd love for you all to play with it, send it to people you know, let us know what you think, and then I will leave us with a plug for, if you want to learn more about Ellie and more about these other projects, we host a conference every year, October 4th to 6th, and because you are all special members of the Global Digital Health Network, we have a very special $20 off coupon for you, and we will have some incredible plenary speakers, a scavenger hunt, really interesting plenaries with UNESCO, and we'll talk more about Ellie, the chatbot. So please join us. And now I will hand it back to Rebecca.
Great, thanks Emma and Flor. That was fascinating. I have so many questions, and I'm sure our audience does too. But for now, I'd like to introduce Dr. Rupan Gill from Vitala Global, who will present Aya Contigo, an application co-created with 1,000 Latinas and Latin America grassroots organizations that accompanies women through a safe medication abortion and family planning journey, providing them with evidence-based, reliable digital resources to avoid unsafe abortion. So Rupan, the floor is yours.
Thank you so much, Rebecca, and thank you to the Global Digital Health Network. It's a pleasure to be here. So as Rebecca mentioned, I am co-founder, executive director of Vitala Global, and it's my pleasure to present our user-centered co-design of a digital solution for self-managed abortion and contraception care, specifically in Venezuela, the opportunities and challenges that we have learned. So what I'll be covering today is to discuss the importance of context-adapted and community-led co-development of digital health tools, specifically around safe abortion and contraception in complex humanitarian settings, present an example of the development of a user and community-centered digital tool, which is Aya Contigo, and then highlight some of the next steps with a focus on young migrant Venezuelans. So the problem. Women and girls living in humanitarian settings are disproportionately affected. Due to the protracted humanitarian crisis, Venezuelan women and girls are experiencing increasing sexual and reproductive health inequities, leading to high rates of unintended pregnancies, unsafe abortions, and maternal mortality and morbidity. Now, specifically in Venezuela, there's the complex humanitarian crises but also there's a very restrictive legal context as well as a cultural and social context, which really kind of complicates the women and young girls' empowerment, and especially around their sexual and reproductive health and rights. It was actually in December when there was a young activist who was put in jail for facilitating a safe abortion, or accompanying a young girl who was 12 years old, who ended up becoming pregnant due to rape. And so this activist was helping her, accompanying her to try to assist her to have a safe abortion. And so that actually led to a lot of sort of the grassroots movements and organizations kind of opening up and vocalizing that there needs to be a change in the country. But it also became very apparent at that time, when we were working with some of our grassroots partners, the importance of digital self-care tools when the local grassroots organizations are implicated in this type of a context. Now, interestingly, the data in Venezuela, actually, it's difficult to obtain, particularly around the national data and what's actually happening there. But what we do know up till 2016 is that there's been an increase of 66% in maternal mortality. Now, with the COVID pandemic and with the work that we've been doing there, we know that these numbers are higher, and not only due to issues around access to abortion, but even just general maternal mortality related to obstetric care, but then also an increase in gender-based violence. About 16% of maternal deaths are due to unsafe abortion, and it particularly increases to 60% in rural and indigenous communities in Venezuela. What we know is that about 80% of young people use the internet to be informed on SRH. The criminalization of abortion prevents its inclusion in sexuality education curriculums. So most young people access abortion information online or through friends and community members. And we also learned about this through our research, that WhatsApp, Facebook, these groups that are created are vital for them in terms of accessing information and connecting with networks within the country. Specific to digital self-care and humanitarian settings. So we know that crises accelerate inequities and access to services and healthcare providers. So, the prioritization and coverage of SRH services in humanitarian settings have expanded over the last few decades. And digital health specifically is a tool that can really complement other life-saving interventions. It's not meant to eliminate the need for providers or facilities, but to really look at how it can actually be implemented and integrated as part of the existing ecosystem. So at Vitala, our mission really is to co-create meaningful digital solutions that are user-centric, data-driven, and community-led to empower young women and girls, and those that identify as women and girls, to achieve their sexual and reproductive health goals. We use a four-pronged methodology, very similar to my co-panelists, which is to do a user-centered research, community engagement, multidisciplinary collaboration, and design thinking. For us, we really believe in sort of developing those very strong partnerships. And we really believe that the tool that we've designed, or Aya Contigo, which I will get to, is really the tip of the iceberg. It's all that's underneath, which is the time and the effort that we have put into building our partnerships and working with a lot of these grassroots organizations that are already doing the work, but just need a little bit of support in terms of facilitating access to women and girls. So what we do is we work with Venezuelan young women and girls, community-based organizations, and us as Vitala Global, and we co-created Aya Contigo, which essentially facilitates self-managed safe medication abortion and contraceptive decision-making. I'm quickly going to go through the first couple of phases of our study, because the way that we work is using evidence-based research methodology. And the first phase of our study, when we were really trying to find out and explore the context in Venezuela, involved us conducting an online survey, which was something that we had to transition to given the COVID-19 pandemic. The plan was to do everything in person, but by using Facebook and Instagram ads through our grassroots organizations and local partners, we were actually able to target 3 million Venezuelan women and girls of reproductive age. And we had run this survey over 6 days. And in this survey, we really wanted to understand how do women engage with technology? What is their experience like living in Venezuela? What is it like in terms of accessing safe abortion? And if we were to design a digital tool with them, what would that look like? What would they want? And we were very pleasantly surprised that within 6 days, we had 1,148 people respond to the survey with a 71% response rate. And interestingly, as I know we are talking a lot today about youth engagement, when we started off, our plan was that we really wanted to focus on women and girls in general. But what we found is that a lot of our participants that responded to our survey were young women, vast majority between the ages of 19 to 35. And I will get into our plans for further youth engagement for folks that are under that age. We know that in terms of smartphone access, there's quite a few of them, about 80% that have access to a smartphone and 43% who said a desktop computer. And what's really interesting is that, and it wasn't too much of a surprise to us as we had known through our conversations with our stakeholders, that many engage through WhatsApp and social media, for example, Facebook Messenger. And now more so, we're recognizing that it's also through Instagram. When we talked to our participants about sexual and reproductive health and how they're accessing the information specifically around that, internet search was the first, and then secondly, their family and friends. And it was really interesting because our participants were not concerned about searching terms, abortion, contraception, sex, sexual health on their smartphone. And they actually weren't even worried if somebody else were to see that they were doing that and searching for those types of terms. We wanted to know, as we were designing the tool, how do they access actual digital SRH information, and how would they want to receive that information? And email and WhatsApp kind of came hand in hand, which also aligns with what we found in our trial when we were testing Aya Contigo. In terms of just the abortion landscape in Venezuela, 43% of our participants had an unplanned pregnancy in their lifetime, and 20% had an abortion in their lifetime. And of those who did not have one, had stated that they knew, so 20 to 40% had stated, about a third, that they knew someone who had a safe abortion with pills. So that's just to highlight that even in a very highly restrictive setting, women are still having abortions, at least a third, which is also aligned with the global estimate that we know 1 in 3 women have an abortion in their lifetime. I'm just going to go through this. Actually, I'm going to just pass by this. And I think if you have any questions, we can kind of talk a little bit more about the findings, because what I would like to get into is a little bit more on the insights and learnings and to show what Aya Contigo looks like. But overall, the insights and learnings that we had from phase 1 was that, it's really important to acknowledge the complex humanitarian emergency. And ensuring that the tool that we design can really be used in that. So making sure that it has offline capability, making sure that it accompanies women in sort of making those complex decision-making in a very supportive and trusted manner. That contraception was a big part as well. So ensuring that there was information related to that. There's a lot of misinformation. So having something that's evidence-based, and then that can connect them to also trusted resources, whether that's nationally within the country or globally. And then as we had gained that information and all that data, we then went through this whole process of working with a UX UI design researcher who's based in the Dominican, and went through an iterative design of our wireframes and went through multiple storyboarding sessions with our stakeholders. And then content also went through a very iterative design process so that we ensured that it was based on evidence-based data, and then did user testing through a platform called Userlytics that was done remotely with 6 of our users. So this was our first prototype that we worked through with our UX UI designer and with our stakeholders. And then this is sort of going through the iteration, and then this was the second iteration of the design. And then eventually we got to Aya Contigo. And even the name, like going through the process of naming it, our illustrations, everything went through a very user-centered iterative design process. And so Aya is a safe abortion and family planning digital companion. And basically it takes users through a safe medication abortion, a self-managed safe medication abortion and family planning journey. There's 3 value propositions for Aya. One is safe abortion care, second is family planning, and the third is to connect them to trusted resources within Venezuela or globally. Aya offers emotional support and self-care guidance throughout the app and with optional WhatsApp notifications. And so the app totally is offline capability. However, with the WhatsApp piece, you do need some internet connectivity, and women can opt into it by signing in, and it allows them to, it reminds them when they need to take their pills, but then also supports them up to 30 days after they've started the process. So some of the key features of Aya, which were in response to all of the research that we had done initially in terms of the formative aspect and as well as the user testing, was that it needs to have offline capability. So our app is actually a progressive web app. So there's a link and then you can download it, and actually it's on your phone as an app. It's a step-by-step guide to self-manage your abortion. So there's 7 steps that women will go through, and that includes self-assessing for eligibility, that they can do the abortion, all the way up to self-assessing that they've successfully completed it. It provides personalized contraceptive decision-making. There's a whole referral network of trusted organizations. And the emotional support and self-care advice was very, very important for our users. And I need to wrap up. Emotional support and self-care advice, and then the ongoing WhatsApp notifications. So in terms of some of the lessons learned and the challenges as I wrap up. So we know one of the biggest challenges for us, and it's related to abortion care and when developing digital solutions in these types of settings, is really ensuring quality, affordable, timely access to abortion pills. And so in Venezuela, in many of these settings, there is a huge clandestine market. And so we have noted from our work now when we've done the pilot testing, is that it's very difficult sometimes for women to access these pills. But what Aya Contigo has been able to do is to really allow us to connect our users to grassroots organizations in a more timely and quick way. So it's really not just about the app, it's also about how we are implementing and connecting and being part of the movement in Venezuela and ensuring that women can access a safe abortion experience. You know, some of our plans are that we are planning to have a continued virtual support aspect to it, because we've learned that the app is not the only thing that is facilitating and helping women, but they also need somebody to talk to answer questions. So we're looking to hire folks that are local as a local Venezuelan community lead, as well as part of our Aya user team. And we have noted that in our next steps that we really want to include more young Venezuelan people as part of our research design and communications team, and really look at more in detail, what does support and accompaniment mean for young Venezuelans, especially those that are under the age of 20. Continue to partner with organizations that are youth-led, and even consider having a young person as part of our board of directors and advisors at Vitella. And finally, we need to be open and agile, because digital is not a silver bullet, and young people are the ones who really know what can work. So given our process and how we work, it is very iterative, and Aya will change. Aya will be different depending on whether it's with young people in Venezuela or as we expand to our neighboring countries. So with that said, I'll stop there and look forward to your questions.
Thanks so much, Rupan. Finally, I want to turn it over to Betiana Caceres from Betiana will present her work with Fundación Huésped on Vamos. So Betiana, go for it.
Hello, thank you. I'm going to share my screen, sorry. Okay. Buenos días. I'm very glad to be here, and sorry, but I'm learning the translation. I need to change that. Give me a minute, please. Okay. I'm very glad to be here. Thanks to GDHN and ETR for the invitation and the possibility to share this space with you. I'm the coordinator of the Digital Innovation Lab at Fundación Huésped in Argentina. And Fundación Huésped works towards a society free of stigma and discrimination, where everybody is able to access high quality healthcare in an equitable manner and where public policies are based on scientific evidence. In this context, the organization develops scientific research and training, as well as prevention and promotion strategies focused on the rights to guarantee access to healthcare. Today, I'm going to talk about our project VAMOS. And in 2013, the same year that the Digital Innovation Lab was created, we also create the web app Donde, that is where in Spanish. And our goal was to convert a PDF file made by the National Ministry of Health with a list of places to get HIV testing or condoms into a digital platform. We were thinking on using technology to improve the access to healthcare facilities, and our main target was young people. The idea was to use that tool as a complement of our distribution campaigns, counseling services, and workshops. In those spaces where we were saying you have the right to access to condoms for free, for example, and with Donde, we also will say where to get them. So the platform which reference data was created, and it grows, including data of other services like vaccination and infectology centers, contraception, and safe abortion. Later, we had the opportunity to establish a partnership with IPPF Western Hemisphere Vision, with the objective to replicate that experience for Latin America and the Caribbean. We worked with them, especially to create the database which located facilities related to the IPPF network. And at the end of 2017, we launched VAMOS, that is Let's Go in Spanish. VAMOS is an open source platform. We've worked with an external development team, and it includes the web app and an app for Android. During 2018, we added an online counseling where our team of personalized attention gives information on sexual and reproductive health to the users. And we integrated a software for customer service. And in August 2018, we started to offer the online counseling through the web app and later also on Facebook. We also expanded the database, adding places from the public sector in some countries, previous to work with social organizations to make sure that the database obtained were accurate and updated. Finally, since last July, we integrated a chatbot, so 24/7, the bot can receive and answer queries, and during our office hours, the users also have the possibility to talk with one person of the team. The addition of the chatbot led us also to add WhatsApp as a channel for contact. The platform includes an admin dashboard, mainly to manage the database with the possibility of create, edit, and delete places individually or massively with an importer. And this as admin role is responsibility of my team. And for the online counseling, we have the integration with another software, and the team in charge of give the answers, log in there to see and answer the question. The call for these webinars refer to us as organizations working at the intersection of youth engagement, human-centered design, and public health across Latin America. In our case, there's no doubt of our work on public health. We have a large experience with a comprehensive approach. We also have been working with young people, promoting meaningful youth participation. Okay, my cat decided to appear here. Sorry. So So we've been working with young people. We include them for the designing ways to involve them on our projects. But also youth participation is one of our ways to work or visions, and the involvement of the target population also. We have more experience to do that on other kind of projects, but not in technology. With Vamos, we involved youth users during the design and testing, and we make adjustments based on their feedback, but we didn't apply a methodology. Our work was more intuitive, unstructured, and also kind of disorganized. And it was based more on our experience with projects at grassroots level on other kind of projects, but not related to tech. And I think we could save time, money, and a lot of headaches if we use an approach like human-centered design. And for sure, the product will reach our target population more and better, and then will be more satisfied with the platform. But I want to emphasize that we are a social organization working on health. That is our focus, and we started to work in 1999, being an organization working in HIV and then in sexual and reproductive health. And we decided to create an area focused on digital innovation, but we are learning how to integrate both worlds. It's not very common, for sure, in Argentina, in my country, and I think in the region neither, having organizations with this structure, these characteristics. So we are learning on the management of tech projects, learning from our own mistakes and from this kind of opportunities. So thank you all. Muchas gracias.
Thanks so much, Tatiana. And I appreciate that all of you were so forthcoming with how important, but also how challenging doing this kind of work is, particularly with young people. We have a couple of questions in the Q&A, some of which our speakers have already answered. I've certainly got some questions, but I want to make sure if there's anyone that has a question that they'd like answered, if they want to put it in the Q&A, or if they want to put it in the chat. But perhaps I can start us off with a question while we give any of you a chance. I think one thing that I'm particularly interested in is how you've been able to engage your user populations during a pandemic. Rupan, for example, you mentioned that you switched from thinking you would do in-person user engagement to doing virtual user engagement. But I'd love each of you to talk a little bit more about that. I think the COVID-19 pandemic has completely revolutionized the way that we work with people. And as people that work in user-centered design, I think we're kind of catching up and figuring out how we might do that. So that's something I'd love you all to share with us. And then again, if any of you 40 attendees would like to put questions in the chat or put them in the Q&A, we'd be happy to move on to this.
Should I go ahead?
Yeah, go for it.
Okay. Yeah, I mean, I'll just quickly say, because I was highlighting a little bit on, because throughout our entire research, like phase 1 was all done through these social media ads, and we really had to pivot quickly. And it was, I mean, again, I think I have to say and give immense gratitude to our partners, because they really helped us to ensure that we could find a way to quickly pivot and get everything online. But I do want to share that the lessons, so we did that for phase 1 and 2, and then also through the UX UI design community, we learned about a lot of remote tools they could use. But then for phase 3, what was really interesting, because all of that, which involved engaging with our users to actually test the app, was done completely remotely as well. And that a lot of it involved us using WhatsApp and having sort of set up a WhatsApp helpline, or sorry, a help desk that allowed us to onboard every single one of our users. And then we conduct our interviews by phone through WhatsApp with young people themselves, Venezuelans that were our interviewers. But I think because of the nature of how people are engaged with technology already, which we learned from our first phase, allowed us to overcome the challenges of in-person research because we already knew that at baseline, they were connected in that way. And one thing I will share is that we were a bit worried about, the building of trust and engagement, because you don't get that same feeling unless it's face-to-face. But with our work, I think because of our partnerships, we were able to gain that sort of trust and engagement throughout the last year.
Flora, do you want to talk a little bit about, because I know you worked really hard to get young people to respond to surveys and to do the one-on-one interviews. So do you want to talk a little bit about that?
Sí, claro. Aquí en Honduras fue bien curioso porque, en definitiva, la pandemia por COVID-19 orilló a los jóvenes que no tenían acceso a servicios tecnológicos a utilizarlos de una u otra forma, ¿no? Y fue bien difícil porque lo más importante para YTH y Go Joven Honduras era que los jóvenes se sintieran seguros con la información que recibían, que se sintieran cómodos y sobre todo que se sintieran identificados, que pudieran decir lo que me están diciendo más allá de que sea un chatbot, de que sea un mensaje por WhatsApp, me hace sentir seguro o segura, me hace sentir cómoda con la información. Para esto sí se tuvieron que realizar ciertas actividades presenciales, ¿no? Como una validación. Nosotros siempre mencionamos que Zona Segura y Eli es el primer chatbot aquí en Honduras codiseñado por jóvenes hondureños. Ellos fueron los que definieron el contenido, ellos fueron los que establecieron con lo que se sentían cómodos, lo que para ellos era más correcto, la información que querían recibir fue a partir de la voz de los jóvenes. Nosotros solo nos encargamos de facilitar todo este proceso y era específicamente lo que buscábamos. Es difícil generar ese sentimiento de confianza y empatía para con los jóvenes cuando estás detrás de una pantalla, ¿no? Y fue sumamente difícil, pero al final el resultado, pues, como ya lo mencionábamos en nuestra presentación, los testimonios que nos dan los jóvenes y los directores de los centros educativos es cada vez mejor. Entonces sabemos y tenemos la certeza de que hicimos un buen trabajo y que a pesar de las dificultades, los jóvenes se sienten identificados y están aprendiendo a manejar estas herramientas tecnológicas que antes de la pandemia por COVID-19 eran muy difíciles de utilizar, pero que ahora hemos aprovechado que los jóvenes se han visto orillados a esto, no todos los jóvenes, sino el pueblo hondureño como tal, para que pueda serles de utilidad para su vida diaria.
Sigo, voy a ir en español para este momento. Para nosotros el contacto con jóvenes se da principalmente a través de las organizaciones con las que articulamos. No se está dando directamente desde nuestra organización hacia los y las jóvenes destinatarios, a quienes esperemos que lleguen. Y en nuestro caso también coincidió que incorporamos y lanzamos el chatbot que veníamos trabajando hace mucho tiempo en estos últimos 2 años, año y pico. Entonces, la validación de contenidos, la prueba, el testeo del funcionamiento del chatbot se fue haciendo de esta manera, intermediada a través de las organizaciones y en un contexto donde en todos los países nos estábamos acomodando a trasladar nuestras actividades cotidianas hacia lo virtual. Entonces, por un lado sí nos impactó en muchas demoras para poder adaptar el cronograma que teníamos y los procesos que habíamos pensado en este contexto, y además articulamos con varios países en la región, no todos tenían la misma situación epidemiológica, no todos tenían las mismas medidas y restricciones. Por lo tanto, sí fue un desafío cómo pensar esa interacción y esa llegada a quienes usarían la plataforma en ese contexto. Y sí lo que vemos es que coincido con mis compañeras respecto a que los canales digitales y estos medios de contacto online se volvieron mucho más presentes, porque fue la forma, y sigue siendo en gran medida, la forma que tenemos de mantener la conexión con todo el mundo, con nuestros seres queridos, con nuestros trabajos y con las necesidades que tenemos. Entonces, sí, poder estar ofreciendo toda esta información y estos servicios mediante los canales online, sin duda que tuvo impacto y llegada. En ese sentido, la pandemia de alguna manera favoreció el instalar este servicio.
Well, thanks to all of you for joining us. Clearly, using digital tools to work with young people, we've only really scratched the surface of what we can do. And I'm so happy to have the opportunity to join you all, and in particular, to be able to highlight really exciting and innovative work that's happening in Latin America. We're just about done this morning. I do want to invite all of you at the Global Digital Health Network to join us at YTH Live in October. I'm going to put the link to register over in the chat, and later today, I plan to send out that discount code to the whole membership. So from here, I think I'll turn it back over to Christina.
Great, thank you, Rebecca, and thank you to all of our speakers, Betiana, Flor, Emma, Rupan. This has been an amazing session, and I'm really, it's really great to hear about all the different initiatives and hard work that you guys are putting into these initiatives. And I also really appreciated hearing kind of the process for developing and co-creation. So often that's overlooked, and so we end up with a bunch of tools that end up in kind of not being used. And so I really appreciate you all spending the time to do that really hard work. And thank you to whoever's funding you to do that really hard work, because often that's also overlooked. And we just get budgets and scopes that want us to develop in 2 months, right? So thank you for putting the hard work into pushing back on that and doing it well. So and thank you again to YTH and ETR for organizing today's session, and to all those who helped get it together. There's a bunch of us behind the scenes who helped get that together, and special thanks to Helen, our interpreter. And with that, we will wrap up for today. Thank you all for joining us, and have a good rest of your day.
Thanks, everyone.
Thank you.
Bye-bye.
Ciao.
Thanks, everyone.